Hello, everyone. My name is Daniel Olanrewaju, and my topic for my project is antibiotic stewardship protocol to reduce antibiotic prescriptions in long-term care facility. Committee members, Dr. Harris, Dr. Lisa, and Dr. Snell, and abstract. Urinary tract infections are commonly suspected in residents of long-term care facilities, and antibiotics are commonly prescribed to patients even when they are asymptomatic. First and foremost, what's a UTI? A urinary tract infection is an infection that affects the urinary system, like the kidneys, the bladder, and the urethra. And also, what is antibiotic stewardship protocol? Antibiotic stewardship protocols are protocols uh, that are coordinated, that promote the appropriate use of antibiotics, uh, that improves patient outcomes, reduce microbial resistance, and decrease the spread of infections caused by multi-drug resistant organisms. This project focuses on antibiotic stewardship protocol, being able to reduce the implementation, being able to reduce antibiotic prescription in a long-term care facility. The purpose of my scholarly project is to actually evaluate the appropriate use and the adherence to evidence-based guidelines in patients with UTIs in Bryan Center Health and Rehab. And the secondary aims include implementation of antibiotic stewardship protocol, educate healthcare providers on antibiotic stewardship protocols with patients with UTI in the facility, determine the effectiveness of antibiotic stewardship protocols in limiting antibiotics use for patients in long-term care facility. A 150 patient retrospective electronic chart review of patients with suspected urinary tract infection was actually used. The findings revealed significant evidence of a change in one direction, which is enough to suggest that uh, antibiotics may be overused or probably inappropriately used in patients with suspected UTI. The study was actually able to discover that compliance with antibiotic treatment guidelines for adults in long-term care facilities with urinary tract infection can be improved with increased education on the use of antibiotics, uh, following the current guidelines. For example, the CDC has very great guidelines uh, on antibiotic stewardship, and tract auditing would also be recommended. Introduction. Antibiotic resistance has been one of the complications of with the overprescribing of antibiotics. Antibiotic resistance. Uh, this happens when uh, bacteria or fungal infection they develop some kind of ability to defeat the drugs designed to kill them, which means the germs are actually not being affected by the antibiotics or the antifungal, which makes the bacteria or the fungi keep growing. Antibiotic resistance is it's an urgent global public health problem, which at least 1.27 million people worldwide are actually associated with, nearly 5 million deaths in 2019 in the US. So it's really a big deal with antibiotic resistance and antibiotic use. The appropriate use of antibiotics has been demonstrated to actually lower the incidence of resistance. Davis and Davis 2010. The purpose of this project was to actually determine if antibiotic stewardship protocol decreases the unnecessary prescription of antibiotics. Uh, the project implemented an antibiotic stewardship protocol, educated healthcare providers and nurses on antibiotic stewardship protocols, and evaluated the effectiveness of antibiotic stewardship protocol for patients with suspected UTI in a long-term care facility. Specific aims. Prior to this scholarly project, no consistent antibiotic stewardship protocol education was provided to the nursing facility staff. The most common cause of unnecessary antibiotic prescription and overuse in patients is a lack of clinical knowledge about current antibiotic uh, stewardship protocols. Implementing antibiotic stewardship protocols, educating healthcare providers on antibiotic stewardship protocols, and determining the effectiveness of antibiotic stewardship protocols in limiting antibiotic use for patients with suspected UTI as suggested solutions for improving patients. The methods used in being able to come with and the result of this project was to actually study the use of quantitative exploratory design based on a retrospective chart review. The data collection instruments include information gathered during the antibiotic therapy stewardship protocol intervention. The data sheets also included the signs and symptoms that patients reported before and after the antibiotic therapy stewardship protocol intervention. On the collection tool, all data were coded and normally transcribed. On the data collection sheet, the author recorded only the information required to achieve the project's objective. And the result, using the statistical analysis of the chi-square analysis with the lower tail z-test, revealed that patients who received antibiotic therapy prior to antibiotic stewardship protocol intervention actually outnumbered those who received antibiotic therapy after antibiotic stewardship protocol intervention. The p-value of 0.0006 is less than the level of significance of 0.005. The findings of the study established the importance of clinicians adhering to antibiotic stewardship protocol guidelines for patients with suspected urinary tract infections. The studies of the importance of clinicians adhering to antibiotic stewardship protocol guidelines, using education as a platform, I believe it's a great way to actually uh, improve prescribing behaviors of providers. These educational methods, I believe, they are great strategies to actually help improve prescription of medications and also improve antibiotic stewardship programs in the healthcare settings. The data analysis result for the pre-intervention and post-intervention after antibiotic stewardship protocol intervention was completed in the facility 3 months after the educational session supported the project's goal. Uh, I do have two pie chart uh, showing the pre-ASP intervention and post-ASP intervention. The pie chart indicates that with 150 chart reviewed, uh, pre-ASP intervention, 89 patients who had where there was a suspected incident of UTI, 89 of them got antibiotic prescription. Why post-ASP intervention, 61% of 150 child review uh, got antibiotic prescription. This is a major change, and this is a major improvement that was actually being able to be derived within a 3 months period. Uh, the analysis, uh, the pre-antibiotic stewardship intervention and post-antibiotic stewardship intervention had statistical significance at the nursing facility. Uh, Using the value of 150 chart, the p-value after the analysis is 0.006, which the significance value is 0.05. The power of the probability of error is 0.9470. The chi-square analysis lower tail z-test revealed that patients who received antibiotic therapy prior to antibiotic stewardship protocol intervention outnumbered those who received antibiotic therapy after antibiotic stewardship protocol intervention. The p-value of 0.006 is less than the significance value of 0.05, which indicates that there's enough evidence to suggest that the ratio from pre to post antibiotic stewardship protocol intervention should be actually reduced. Discussion. This project's primary strength was determining whether clinicians at the Bryan Center, nursing and rehab followed current antibiotic guidelines in patients with suspected urinary tract infection. Overuse was the most common reason for severe infections, complications, longer hospital stays, and increased. For the purpose of this project, overuse refers to an antibiotic that, according to CDC guidelines, should not have been prescribed in the first place. CDC made it really clear that overuse of antibiotics, especially taking antibiotics when they are not actually the correct treatment, promotes antibiotic resistance. According to the CDC, according to the CDC, one-third of antibiotic use in people is actually not needed or they're actually inappropriate. And based on examples, I've actually seen incidents where patients uh, had some irritations in their and had some irritations, and the nurse would actually call the provider and say, "Hey, my patient is having some irritations, and I think the patient's got a UTI." And I've seen firsthand where providers actually say, go ahead and say, hey, let's prescribe a Cipro 500 milligram BID for 7 days, and let's call it a UA uh, with sensitivity and see culture and sensitivity and see what's actually going on. But along the line, when the results comes back, we notice that the Cipro which the patient has been on might not actually be the appropriate antibiotic that was being that should have been prescribed for this patient. So at the long run, the patient might have been on Cipro for 3 days, which was an inappropriate prescription pending the culture and sensitivity comes back, and the antibiotic is actually switched to something different. So there are evidences that shows, even in my practice, that I've seen this occur several times. Um, and there are several articles and studies out there that argue for less antibiotic use in patients with suspected urinary tract infection. These studies findings support the project's findings of increased antibiotic stewardship protocol knowledge and decreased antibiotic therapy use in patients with suspected urinary tract infection. Implications for nursing. The scholarly project gives an insight into the problem, the negativity impact of overprescribing or inappropriate use of antibiotics of patients in the long-term care facility. Each point of care provider can work to reduce antibiotic use and slow the spread of antibiotic resistance. The nursing facility data can be used to improve processes such as increased antibiotic awareness, specific antibiotic use education, and antibiotic stewardship. Some clinicians may believe that this is a global uh, issue, but it all starts with an individual, according to Bandura 1991. I believe as future clinicians, we should actually start with us, knowing that the impact antibiotic prescription and antibiotic stewardship protocol would have on our patients. I think it's critical that we actually uh, take it seriously. Most nursing homes are still in the early stages of antibiotic stewardship, and this is actually true based on my experience in the facility that I did my project. There were no actually guidelines that the facility was actually following, and I'm sure if that could happen uh, in a setting, I believe there are other nursing homes, facilities that are actually not uh, having any antibiotic stewardship protocol in place for their patients. So I believe future research on antibiotic stewardship programs and interventions in nursing homes must make better use of program theory to be able to actually take care of their patient properly and have a guideline in place. Important future research should be conducted on use of educational interventions, which is a successful strategy for improving antibiotic stewardship protocol adherence in patients with suspected urinary tract infection. This will help us understand the needed improvements in nursing home antibiotic stewardship infrastructure and identify the interventions that will have the greatest impact on critical antibiotic utilization and outcome measures in the future. I believe having interventions in place, will be of great impact on antibiotic utilizations in the nursing home, and most importantly, the uh, outcome of those antibiotic measures on the patients. Uh, uh, During this project, I was able to actually understand that education and continuous education is actually the key to actually help clinicians to actually understand uh, the fact that there are new ways of doing things and there are better ways of doing things. to keep our patients safe, to keep them to make them have better outcomes of the treatment that we're actually providing. And these are my references, and thank you guys for watching.